Have you heard someone in your family say, heart attacks run in our family, it's all in our genes, there's nothing that we can do? Or my personal favorite, heart disease is our inheritance. So what does that really mean? Is it a guaranteed fate, or can you rewrite your story? Namaste, I'm Dr. Amonkar, and today we are tackling a topic that often gets oversimplified or blown out of proportion: family history and heart disease. By the end of this video, you will know what family history really means for your heart health, how to ask the right questions about your family's medical background, and what you can do starting today to take control of your heart health. Because while genes do play a role, they don't write the whole script. So let's dive in. First, let's address the elephant in the room. If my family has heart disease, I will too. This is one of the biggest misconceptions out there. Genetics do play a role, but they are only part of the picture. Your lifestyle choices, what you eat, how you move, and how you manage stress can either amplify or override those risks. Also, our environment and medical care that we receive have a massive influence on your heart health. If I have to give you statistics, genetics will contribute about 20 to 30% to your heart disease risk, but the rest is influenced by lifestyle and also your environment. In India, where heart disease often strikes a decade earlier than in Western countries, lifestyle factors like high-calorie diet, sedentary habits, and chronic stress are all amplifying risks, even for those without a family history. In fact, 80% of heart disease cases are linked to preventable factors and not necessarily genetics. So, think of your family history like a deck of cards. Your genes may deal you a certain hand, but how you play that hand, your lifestyle choices, determines the outcome. Let me put it in another way. Genetics may set the stage, but it is your behavior that writes the script. Okay, so let's break it down. What does family history really mean? It's not just about whether someone in your family has had heart disease. It's about who, what, and when. It's more than just having a relative with heart disease. It's about understanding the patterns, timing, and the context. So firstly, who matters? First degree relatives like your parents, siblings, children, they are the most significant. The risk from second degree relatives like grandparents or uncles is a little lower. So if your grandparent with a heart disease at 50, that may not be as significant or concerning as a father who has had a heart attack at the age of 50 years. Secondly, what matters? So the type of heart disease, so what is it, a heart attack, is it an arrhythmia or a valve issue? These distinctions matter because genetic risks in each case will differ. And finally, when matters. Early onset, that is before the age of 55 in men and 65 in women, is a red flag. Later onset may be less influenced by genetics and more by your lifestyle. So if you had a great grandfather who had a heart attack at 92, please don't panic. It's not your genes talking, it's just time catching up. Okay, so how would you know your family history? Now that's the part where you get to play detective. To truly understand your risks, you need to gather the right clues. Here are 5 questions to start with. Has anyone in your family had a heart attack or a stroke? How old were they when that happened? Were they diagnosed with high blood pressure, diabetes, or high cholesterol? And any history of sudden death or any heart rhythm issues in the family? And finally, did they have heart valve disease or conditions like hypertrophic cardiomyopathy? Now, please do not interrogate family members during dinner time. It's going to be a little awkward, but keeping a record of these answers is invaluable for your doctor. Talk to your family, gather this information and bring it to your doctor. It can make a huge difference. So think of your family history like a treasure map. Each piece of information that you provide is a clue guiding your doctor to better understand your heart health risks. The more detailed and accurate the map, the better is going to be the prevention strategy. To make it easier, use tools like a family health history form. So many hospitals and clinics, including us, we offer these forms during checkups. Then there are apps and digital trackers that can also help organize and store this information for future reference. In the next section, I'll explain to you how to use this information and assess and manage your risk. Now let's talk about genes. Your genes play a significant role in determining your heart health. But what does this actually mean? So genes are like the blueprint of your body. They determine everything from your eye color to how your heart functions. So if there's a flaw in the design, we call that a gene mutation. It can affect the structure of the protein that the gene encodes. So this can cause an organ or a process malfunction. While single genes are faulty, we call them monogenic disorders. For example, familial hypercholesterolemia. So this is a disorder wherein cholesterol levels reach very dangerous levels. It can affect 1 in 250 individuals globally, and in some communities in India, the prevalence is even higher. Extremely high bad or LDL cholesterol will lead to early onset of heart attacks. So untreated individuals face a 50% risk of a heart attack by the age of 50. Second is hypertrophic cardiomyopathy. It is a genetic condition where the heart muscles thicken. This increases the risk of arrhythmias and sudden cardiac death. This is an autosomal dominant condition that is often passed on easily to the next generation and diagnosed in multiple family members. Another one, this is also a monogenic genetic condition, long QT syndrome. This disorder affects the heart's electrical system, leading to life-threatening arrhythmias. So these monogenic conditions often follow what we call as a Mendelian inheritance pattern. This means they can pass directly from the parent to the child. So if one parent has the mutation, there's a 50% chance of passing it on. On the other hand, polygenic heart diseases, they are caused by a combined defect of many small genetic variations. So each of these variations or gene markers, they contribute a tiny amount to your overall risk. So most of the commonly occurring heart diseases like coronary artery disease, which causes heart attacks, hypertension, atrial fibrillation, they are all polygenic diseases. Unlike monogenic diseases, polygenic conditions, they are heavily influenced by your lifestyle factors. That means even if you inherit a high-risk genetic profile, making a heart-healthy choice can significantly reduce your overall risk. So think of monogenic diseases as a recipe with just one key ingredient. So if that ingredient goes bad, the entire dish is affected. But polygenic diseases, on the other hand, they are like a recipe with many ingredients. So especially if you balance them with a healthy addition like exercise and a good diet, then it just won't get through it. We discussed about genes, but remember, family history isn't just about genes. It's also about shared environment and habits. There's a fascinating concept called epigenetics. So this is how your environment and habits can literally influence the way your genes express themselves. So even if your family history isn't perfect, your lifestyle choices can overpower these genes. Think of it like a light switch. Genes may turn on or off depending on your lifestyle choices. And the best part, positive changes can impact not just you, but potentially your children and grandchildren. So your grandkids might thank you or blame you for their health. Shared habits such as smoking or eating high-fat foods contribute significantly to risk. If your family has a tradition of fried foods and sedentary evenings, that's a bigger red flag than you might think. So when we think about heart health, we often ignore our environment. From the air we breathe to the stress of daily life, environmental factors significantly influence your heart health. Air pollution is a silent enemy for your heart. Studies have shown that exposure to high levels of particulate matter increases the risk of heart attacks, strokes, and also hypertension. It's not just about breathing difficulties. These tiny particles, they trigger inflammation in your blood vessels, making them more prone to damages and blockages. Statistics have shown that there is a 20% higher risk of cardiovascular diseases in areas with high air pollution. In urban areas, stress is another environmental factor impacting our heart health. Long commutes, high pressure jobs, and constant connectivity through devices creates a cocktail of chronic stress and physical inactivity. Stress triggers the release of stress hormones like cortisol, which can raise blood pressure and keeps your heart in a constant overdrive mode. So think your heart like a pressure cooker. So a little steam and occasional stress is manageable, but if you keep the lid on and the pressure build with no release, it's bound to explode. So that's what chronic stress and a sedentary lifestyle does to your heart over time. But the good news, regular exercise can reduce heart attack risk by 30 to 40%. Even in high-risk individuals. So diet full of fresh veggies and fruits, which we often call as the Mediterranean type diet, that can lower cholesterol, blood pressure, and improve your overall heart health regardless of family history. Managing stress, and yes, that includes ignoring WhatsApp forwards about miracle cures, can definitely help you. Now let's dive into a very important aspect, evaluating your personal risk. So even if you have a family history of heart disease, assessing your individual risk can give you clarity and direction, as your risk may be different from that of your cousins. Apart from the routine blood sampling for sugars and cholesterol levels, blood pressure charting, and stress testing, there are some simple and advanced tools that can help in understanding your risk. So first is the ASCVD risk calculator. Now this is a powerful tool that helps estimate your risk of developing atherosclerotic cardiovascular disease, that is heart attacks and strokes, over a period of 10 years. It considers factors like your age, gender, your cholesterol levels, blood pressure values, smoking habits, diabetes, and even whether you are on treatment for hypertension. So based on these inputs, it provides you a percentage risk score that can guide both you as well as your doctor on whether you need lifestyle changes, medications like statins, or any other preventive measures. This score adds insights for managing statin therapy and also empowers you to have an informed discussion with your doctor. Next comes coronary artery calcium scoring. So it is a specialized calcium CT scan that helps measure the amount of calcified plaque in your coronary arteries. So that is the arteries that supply blood to your heart. The more calcium that is detected, the higher your risk of having a heart attack in the future. It's a quick, non-invasive test that provides a better picture of your heart health even if you do not have any symptoms. A higher calcium score signals the need for aggressive prevention strategies, while a low or zero score provides reassurance that your risk is minimal. Next comes a CT coronary angiogram. So this is an advanced non-invasive imaging test that uses a CT scanner to create detailed 3D images of your coronary arteries. So it helps identify blockages or narrowings that are caused by the plaque buildup, and it gives a clear picture of your heart's blood flow. So we use this test for individuals who have a moderate risk of heart disease. Next comes genetic testing. We are slowly entering an era of precision medicine with tools like genetic testing. So testing of your blood, saliva, or a cheek swab for specific gene defects are the best for identifying monogenic diseases like familial hypercholesterolemia. Now, this is not for everyone. Your doctor will usually advise that if you have multiple family members who are affected, especially at a younger age, very high cholesterol values at a young age, or a family history of sudden cardiac death, then you should have these tests done. And then there is advanced lipid testing, which measures markers like lipoprotein A, which provides a deeper understanding of your cardiovascular risk beyond a routine lipid profile, which measures your LDL, that is bad cholesterol, triglycerides, etc. High sensitivity C-reactive protein, HSCRP, indicates inflammation in the body, and these markers can give an additional insight about your unique risk when used in the right manner. Let me reiterate again, all these tests are not for everyone and their use needs to be individualized in consultation with your cardiologist. But with these tools combined with a detailed family history, they will definitely help us understand your risk better. But knowing your risk is just step one. Next, let's take action to rewrite your heart health story. So here's your game plan. First, get screened. If you have a strong family history, start screenings early, beginning as early as your 20s or 30s. For those with a family history of hypertrophic cardiomyopathy, we advise screening with an echocardiogram as early as adolescence. Annual checks for cholesterol, blood pressure and sugar, they are a must. Understand and monitor your numbers. For cholesterol, you should know what your LDL or bad cholesterol values are, your HDL or good cholesterol values are, and your triglyceride levels. For blood sugar, keep testing at intervals and keep your fasting glucose below 100 mg% and HbA1c under 5.7%. Use the leverage of heart healthy lifestyles. Cut down on those processed foods, focus on whole grains, fruits and vegetables. Exercise for at least 150 minutes, moderate intensity activity per week. Quit smoking, limit alcohol. Yes, your genes may load the gun, but it is your lifestyle that pulls the trigger. And consider testing tools like calcium score, advanced lipid testing, and genetic testing for rare conditions like hypertrophic cardiomyopathy. So all this can provide more clarity about your risk. And finally, ask your doctor about the next steps. These could be actions like maybe starting a cholesterol lowering medication, getting an angiogram done, or even some advanced procedures like a shocking device for conditions like cardiomyopathy or long QT syndromes where they can prevent a sudden cardiac death. And most importantly, do not panic. Knowing your risk is empowering. It means you can take control. Remember, genetics are powerful, but they aren't destiny. Your choices matter more than you think. I remember a patient whose father had a heart attack at the age of 50 years. The patient told me, I'm going to break that cycle, and he did by embracing a heart healthy lifestyle. Today is in his 60s with a clean bill of health. Family history gives us a roadmap, but you get to decide the destination. By understanding your risks, getting the right tests and making heart smart choices, you can turn a family legacy of heart disease into a story of prevention and good health. So if you found this helpful, subscribe to our channel and share this with your loved ones. Let's spread the message that heart health is within everyone's control. Remember, your family history might be written, but your future is still in your hands. See you in the next video.